Good morning, Dr. Rapaport.
Good morning, John. It's so nice to see you. Happy New Year.
Happy New Year. We said we weren't going to do anything until after the holidays, yet here we are.
You pressured and I pressured. My getting comments from all over the world from new patients is endless. And during the holiday season, they go down the deep gutter and they are writing me to please help them. And we both thought, let's do it. We both thought nobody would be watching, and you're so damn smart. You thought that those kinds of people are watching during the holidays.
I don't know that's smart. I just know that during the holidays, especially not feeling well, it's just awful.
It's so sad. And it brings up, I'm not sure which way we're going to go with this conversation, but it brings up a deep anger and frustration that I have with the entrenched society of medicine, avoiding writing up my papers, avoiding understanding that these are not eczema people, they are addicted, and avoiding anything and everything that's negative about the new drugs that are out that are selling for immense amounts of money, and telling the doctors that you should tell your patients they need to be on the drugs for life. It's outrageous.
Well, we'll delve into that because we're going to launch a new front. We've strategized a new approach, and we're going to talk a little about that in a second. First of all, I want to thank everybody for joining us. This is our fifth rendition of these dialogues, and kind of where this came from is that Dr. Rapaport and I have had these conversations now in private for a number of years, and at one point we just said people have to hear this, so we're gonna record these dialogues, and really that's what these episodes are, is our private conversations that we think people can benefit from. But yeah, it is the holidays, and there is much to talk about. I guess I would also like to start with apologies for the audio in the fourth episode. We recognize that, and we'll do better. We won't have that problem. The other thing I would like to add is that we're going to be adding Dr. Rapaport's personal email in the description on this video, and feel free to reach out to him, if not just to say hi, or if you're suffering, or if you need a word of encouragement. And I'd like to talk a little bit about that. If someone, doctor, is in Minot, North Dakota, and they're suffering, how are you in West LA going to help?
Well, I think there are several answers I can offer, allowing for it to sound logical and why it's working. I've always been interested in psychiatry from medical school days, from undergrad days. I changed into internal medicine, dermatology, because I could still practice psychiatry. And it offered other opportunities in medicine, which I enjoyed. So I try my best to listen with the third ear, where that patient is coming from, how are they handling these things, where and why are they suffering, how best to get into their head, how best to hold their hand. I know how to do it in the office, sitting next to them and holding their arm. I have learned, I think fairly well, how to do it 3,000 miles away via a telephone call or the internet. Not perfect, but I care. I want to make them better, and I hear their sadness, and I will never end the conversation without bringing them out of that rabbit hole, and for them to move on with a positive nature for the rest of the next weeks.
So, I mean, that psychological aspect is, of course, invaluable. But what about coordinating with a local physician to help them with medications for symptom mitigation?
Well, the vast majority, pre-COVID and now, I've had their local doctors write the prescriptions if I'm dealing with someone from far out of LA. Had almost 100% success. We stay away from the dermatologist and the allergist, who are absolutely refusing to be involved because they believe, like every religion, that they're bad eczema people and they need to be on drugs the rest of their life, like Dupixent, which we will get into in a few minutes. Valueless Dupixent. Their internist, their GP, who cares about them. I asked them to search them out. So far, been okay with that. I cited that during COVID, when there was a dearth of involvement with outside physicians, I wrote the prescriptions. I couldn't care less if it was 3,000 miles away, because they were suffering and there was nobody there to help them. And it was okay. But I wanted the patient to have somebody close in case they needed a helping hand in the middle of the evening or on a weekend, somebody else to turn to other than me. And it's worked out. It's worked out perfectly fine so far. I've had patients go to their GP and they've written for cyclosporin when I sense that that's what's needed. So far, okay. We've had a couple hitting our head against the wall, MDs, but I'd say nearly 100%. It's worked out quite well.
So this is a point that we can't gloss over. I'm sitting with a professor of dermatology at the University of California, Los Angeles, who's telling our viewers not to seek therapy from a dermatologist for their topical steroid withdrawal.
I'm sure. No, I know. There must be dermatologists out there.
No, but I mean, that's a stunning comment.
Well, it's come from experience because of all the rejections. Hundreds upon hundreds. Derms who will not answer my phone call. Those who will not read my papers when the patients bring them to them. So I have this avalanche of negativity, and why fight it? Another rejection on the telephone? I'm sure there are derms out there, of course there are, who understand this problem and know how to handle patients and care about their patients. I don't know them. I don't know who they are. They don't phone me. They do their own job in their own way. But the vast majority are just refusedicks. They're like Russian, scalawags who go against the government. Absolutely stick to the rhythm and the gospel of bad eczema. You need big guns and you need more steroids. And they do not see anything other than that as the diagnosis, and they are poorly trained. And they don't even look at the patient or talk to them. And they have put them in a dire strait that necessitates, and maybe getting back to your original question, how can I talk psychology? Because I know they're going to be cured, so I can be positive. These doctors cannot tell those patients that. And then they start kicking them out of the office and want nothing to do with them because they're dealing with a soul who is miserable and crying in front of them with tears, and they can't handle it. They really should never have become doctors.
So you just said that they're going to be cured.
They're going to be cured. Period. Because the diagnosis is steroid addiction, just like opioid addiction, amphetamine addiction. If you stop the drug, you will be cured. Well, it takes a long time with this situation. It takes several years. Depends how long they've been using steroids. But they're cured. Cured. No rash, no creams, no doctors.
I've heard that a million times, and I still get a little lump in my throat when you say it. It's just such an incredible thing to hear. And I don't mean to be dramatic, but it really is.
Well, when you periodically, those who are cured will write on my Facebook or somewhere else, Thank you so much, doctor. I've been cured for the last 5 years. I don't even think about my skin anymore. I'm leading a normal life. I didn't realize how miserable I was, et cetera, et cetera. It's a pleasure, a pleasure. What, I'm going to collect those names and ask them to, get a notary to, sign on that they thanked me or that they're cured? How can we do that?
Yeah.
They're out there. Hundreds of them are out there around the world. And they go about their life and their business. They're not marching down the streets, voting for a different group of dermatologists or changing medical school. They're cured and they move on.
Well, I'm hoping that through your mission of helping people remotely and them seeking medical collaboration with you, that we can slowly change the mindset by virtue of some of these internists or GPs that people are seeing success with your symptom mitigation protocol, for lack of a better word.
Well, a rational, logical physician, if he's confronted with the possibility that a drug might be causing problems, is not unwont to stop the drug. Understands that maybe I've got to take a different approach and my patient is suffering here. And that's all we're asking him to understand. And the suggestions that I have for symptom relief are with very, 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 very safe drugs. Antihistamine, anti-pain medicine, sleeping pill, et cetera, et cetera. For the vast majority, 75% of the addicted people will be cured that way. But it takes several years. And it needs hand-holding and a practice of being kind to this long-term patient and understanding the plight that they're going through on a daily basis. Can't work, can't go to school, can't function. And if it comes to that and they're depressed, suicidal even, I talked to parents and a 20-year-old boy a couple days ago over Christmas, suicidal, then we go the route of cyclosporin, which absolutely has cured over 850 patients.
Well, you say cured. It's made the withdrawal manageable, basically.
They
right?
function.
Yeah.
In fact, the rash goes away within several weeks to a month. They're really doing very well and tolerating life within 3 to 10 days. They stay on the drug anywhere from 1 to 3 years with tapering doses, and it's stopped, and they're cured. They have white or normal colored skin. If they're black, if they're Hispanic, they're normal skin color, no more redness, no more oozing, no more swelling. They sleep, they're not in pain, and it's gotten better and better and better. I have tried in the past repeatedly and stopped very quickly to taper the dose sooner than I should have, because both of us, patient and me, look how good they're doing, and I think we'll get away with it. And we don't get away with it. It's 2 to 3 year amount of time for them to be on drug if they just started when they began withdrawal.
I think that's an important comment, because I know people that are new to topical steroid withdrawal are going to find your channel and be looking for everything they can consume on the subject. And in that regard, I have a personal animus, for lack of a better word, towards, I don't want to step on any toes here, but someone that gets on YouTube or TikTok or social media and says, I am gluten-free, I am GMO-free, I am using whatever. I'm using
detoxing.
I'm detoxing, acupuncture, all this stuff. I'm starting to have a problem. I am having a problem with it, to be honest with you, because my sense is it's giving false hope.
You're absolutely right on. The amount of money spent, the amount of time wasted, the amount of a life wasted on what I call garbage talk is immense. Understandably, anybody who's suffering with anything used to ask their local doc for help 50 years ago. Might have turned to their family, a friend who's a doctor. Today they go to TikTok or they go to the internet. On those facilities, every patient puts up what they believe helped them be better today. So
which is different than coping, right?
Right.
Coping, putting, if somebody says, hey, I put Vaseline and sea salts on, great, if that's getting you through this. But to say going gluten-free is going to make your TSW go away.
Right.
I'm sorry to interrupt you.
It's very sad. It's very sad. And they have reached out to every form of medical care. I talked to another patient last night from Toronto, Ontario, and Toronto, who gave $1,500 to a guru, a self-anointed guru on YouTube to detox him. Obviously, absolute wasted money, garbage, was lied to by whoever this soul is. And these people are out there preying on the desperate souls that all of these red people are. How do we spank them or slap their wrist, those individual patients who believe that they are righteous in their thinking and doing, and advertising what they didn't eat, what they did eat, what they rubbed on, how they divorced their husband, how they got rid of their children, etc. How do we stop them from writing this on the websites?
I've lost friends over it. I had a friend that said, hey, I've got this acupuncturist, I've shown her your photographs, and she'll fix you right up. And I know that not to be true, because I've never met one person who's been cured by acupuncture or any of the things that we're talking about. But then the response from this friend was, when I thanked them, thank you, but that's not the path I'm going down. The response is, oh great, then you be sick. I've done my part. I've given you the keys to the city, and you've chosen to reject it, so go suffer.
Yeah.
So that's why I think this is such an isolating disease.
Well, you're right. The rabbit hole gets deeper and deeper because every contact they have in the real world is just your skin. So you're itching a little bit. Come on, stop it. Put your jacket on and go to work. What do you mean you didn't sleep last night? Take a sleeping pill. Drink some wine.
Yeah.
Hey, come on, stop complaining. I've heard your woes now.
Yeah.
It's enough already. They do not understand, these acquaintances, friends, that the patient is suffering 24/7. It's either an itch, a pain, a burning, a scratch. Can I go to this party? Can I put on clothes? Should I take a shower? No, it burns. Should I take a bath? No. What should I put on? It's endless. That's the only thing they think about all day long. That's sad. And I think I can exemplify and solidify this sadness. Let's look at the days involved. If I tell you that they've been miserable, let's say for 5 years, 10 years, multiply that by 365 days. Well, is that 2,000 days? 4,000 days? How about when they go into withdrawal? They stop the steroids, and it takes 3 to 5 years. That's 2,000, 3,000 days every day, still suffering if they don't get any care. How would you like to suffer every day, not knowing whether you can make it through the day, and really do think of suicide? And they do. From a disease that is not a disease.
Right.
It's doctor-induced.
Right. You're correct, and thank you for correcting me because I misused the word disease. It's not a disease.
No, doctor-induced.
Yeah. Yeah. Exactly. Well, and that's why, and that's one of the values I think of these discussions we're having. I implore anyone that is going through this to share these YouTube videos with your loved ones so that they get some sense from a third party that you're not crazy. You're not crazy, and what you're going through is real. And this guy in West Los Angeles, Dr. Rapaport, is not out trying to make a buck. As a matter of fact, you're funding all of this. That cannot go unnoticed.
I guess I can say it's been my lifelong work. I've been doing it for 35, 40 years. Of course, I've seen all kinds of other things in dermatology. I had a full dermatology practice. I taught at UCLA. I've written papers. I've done all kinds of research. This was only one of the diseases, but what has evolved is that I've seen more and more and more as each year goes on, and I've seen worse and worse and worse because the most recent patients have been using super potent steroids for the last 40 years, and they're miserable. Whereas the ones who use just weak and mild steroids were okay, but tolerated the problem, but never got this bad.
Yeah.
The promises also of the individual patient are despicable, but it's sad, but it's only one person. The promises of the drug company are really despicable. Outlandishly scalawags, outlandishly scamming the public, outlandishly charging outrageous sums like $40,000 to $80,000 a year for their new drug. The prime example is Dupixent. It's been around for 5 years. There has been no paper about curing anybody. The original papers, and we'll get into that later because I have a huge amount to talk about, totally valueless versus placebo, and most of the patients who were studied were still on steroids.
Well, I want to back into that discussion just a little bit because we got a note on one of the videos where you said, please, this person wrote in and said, please talk more about skin biopsies. Almost all TSW sufferers seem to have a diagnosis of atopic dermatitis. This makes dermatologists believe that they will have atopic dermatitis their whole life. My derm said once I am off steroids, my biopsies still show up as atopic dermatitis. I begged to differ from reading somewhere that biopsies show steroid damage. Is atopic dermatitis biopsy basically a sign of topical steroid withdrawal, steroid damage? Great to see you commenting back on posts. And you responded. And this is an incredible comment that just hit me right between the eyes. You said, it is now steroid addiction, no more atopic dermatitis. Different clinical and different biopsy. What does that mean?
Well, I must explain. I think the public in general, when they hear the word biopsy, it is typically of tumor or tumor-looking situations throughout the body. That's why you do biopsies for the vast majority of problems. In dermatology, you do biopsies on peculiar rashes, on blistering diseases, on things like that. But believe me, the vast majority of biopsies of kidney, of liver, of skin, of wherever, is because of the concern about tumors. So the public thinking that, hear the word, oh, it's atopic. No, it's not atopic dermatitis. It's a very non-specific answer. It is spongiotic dermatitis, which is fluid between the cells, sponge. And that is seen in contact dermatitis, atopic dermatitis, and across the board in every steroid addicted patient, because that's what steroids do to the blood vessel. It's very nonspecific. It is not a slam dunk. So coupled with that, because now they have some proof, the doctors, and the pathologist, almost in cahoots, writes atopic dermatitis, they know, from now on, the rest of your life, you're going to have to be on drug. They're misinterpreting a non-specific diagnosis. They're doing the biopsy on patients not to look for the answer, but from their training, they rarely, if ever, saw a rare diagnosis called mycosis fungoides or Sézary syndrome, which is lymphoma of the skin, where the patients die rather quickly, and they're doing biopsies to be sure they don't have a lymphoma. That's the reason they're doing biopsies. So it's a test that is inappropriate, unnecessary, leading down the wrong path, and leading the doctors totally astray, and leading them into more and more drug. Well, woo, madam, you don't have lymphoma, but we're going to take care of you. I got several new drugs for bad eczema, which is what you have. Totally false, absolutely false. And the doctors refuse to keep an open mind on this, and to think. The patients come in telling them the diagnosis. They refuse. You can't tell me, madam or sir. I'm a doctor. I'm a dermatologist. You can't tell me. Don't give me a paper from some nut in California published in a peer-reviewed journal. Who knows who that guy is? Etc., etc., etc. It becomes a fight. Have you ever heard of doctors fighting with their patients? They cure them. They hold their hand. They mollify their angst. No, not in this situation. There's such anger.
See, this is why I put the therapies, whether they're topical steroids, injectables. I see there's oral medicines available for what they're describing as eczema. I put that in the same basket as veganism, gluten-free, acupuncture, because at the end of the day, the person continues to have the symptoms and they're miserable and they lose hope. That's the thing that just crushes me. They lose hope after spending $30,000 on a drug.
Well, that, or their insurance spent hundreds of thousands of dollars, and they think as long as they didn't have to write a check out, but now maybe I got to write a check out. No, I don't want to do that. For real good therapy and the right diagnosis. The doctors, I can't get into there's so many of them thinking this way, I don't know how to address them. What has also occurred, which probably influences the average dermatologist, allergist, is that the papers have been written by the professors of dermatology at multiple institutions who donated their patients to the drug company to study the new drugs, donated their guinea pig patients, and watched them with a protocol disseminated amongst probably anywhere from 10 to 30 doctors, because none of them had enough patients. So you got 20 different pairs of eyes observing. I strongly doubt that any of the doctors wrote the paper. I am certain, almost, unless I'm proven otherwise, that the drug company wrote the paper. The drug company advertises in the journal, and the journal published the paper. Faulty papers.
I think it's important to note, 5 videos in, that anybody watching these videos can just look at the comments of both this video and the 4 previous ones where people are talking about, I tried XYZ, I tried, name brand drug that I see on TV all the time. I was on it for 3 months, 6 months, and I'm still in the same boat. So it's not just some you wacky doctor in West Los Angeles. We can read the comments and experiences of people who are seeing your videos.
Well, let me hark back to a comment I made 10 minutes ago. If you've got something that takes 5 days, a disease, 2 weeks, 6 weeks, well, you have a pretty small window of time. If you've got something that takes 1,500 to 4,000 days, with a variation every day in terms of redness, flushing, sleeplessness, itch, whatever, misery, despondency, how can you give credit to either something you ate, didn't eat, drug that you were on for 3 weeks or 3 months, and you got bored, or you didn't have the right dose, or you were given the wrong medication, or. So all of this is based upon 17,000 different situations. How can you equate what's going on? How can anybody write a paper about it? How can you ask Dr. X or Dr. Y or Dr. Z, please help us with your experience with drug so-and-so? Well, I've only had 2 patients on it. Well, I really only had 1 patient on it. Well, I put him on the drug and he seemed to do well. I never saw him again, etc., etc., etc. And the professors are being paid to give lectures to derm groups around the country. The young salespeople are being sent into the offices with free lunches, with free coupons to start the patients.
And Uber to get you there and back, by the way.
Yeah.
Jacob writes a thoughtful post, one of the comments. He says, this feels surreal. It really seems like a crazy conspiracy theory. But the difference is that this is absolutely terrifyingly real. I can't imagine how it must feel researching this topic for 40 years and knowing about what's going on, but still having no influence to change things for the better. You, Dr. Rapaport, are very brave for talking about this publicly. Honestly, I'm still afraid to talk about it to people in normal conversations, let alone advocating for systematic change publicly.
Well, thank you. And I think I did thank him with a reply. My pleasure is getting every patient well. It's come down to that, one by one by one by one. Of course I would like to change the attitude. Of course I would like more papers of mine to be written. Of course I would like to be invited to give lectures about this. It doesn't happen. And then I go back into my area surrounded by rabbit holes and just extricating the sad patient out and curing them.
Well, and that's really why we would like our viewers to like, share, and subscribe to this channel so that they can become, I guess, Pied Pipers of some sobriety as far as this is concerned.
We surely, I think the last time I looked at Series 1, Series 5, Series 4, there were like 1,500 on Series 1. There were 700 on this last one, number 4. Well, they're not TikTok people or, Kardashians watching for entertainment at night. They're all with this entity, I'm sure, the vast majority. But it's still a small number. I think we have to go another route.
Well, and we are. But what I will say is it's a very esoteric subject. And our videos are a little long because there's so much to say. And I'm very much appreciative of people that take the time to watch, and am heartened by the fact that your words are giving comfort And this person goes on, and we're going to talk a little bit more about that other tactic. But Jacob continues to say, thank you for not giving up despite this situation in the medical world. Definitely who are not in favor of what you're advocating. All the while still remaining calm and focused, evaluating all the possibilities and supportive treatments to help with the withdrawal. But here's the money shot. What bothers me is the number of scam treatments and magical cures emerging from around this condition. I also fell for these, TCM, homeopathy, etc. In my teen years when I was still heavily dependent on steroids and desperate. So people are seeing that they're led down some of these rabbit holes and aren't going to help them.
Rearing its head for the 50th time is moisturizer withdrawal. That they're cured because they stopped putting moisturizers on. Endlessly, numerous people. That's how long did it take you to be cured? Oh, 6 months, 7 years. But it's because I stopped moisturization. And they keep advocating that. And the novice, the new patient, looks at that and says, oh, that's what I got to do also now. Plus what you mentioned before, acupuncture, gluten-free, leaky gut, toxins, detox, IgE, eosinophils, etc., mast cells, the whole litany of every noun in the derm textbooks is brought to bear on these websites.
You made a comment to me years ago, very early on when I first was getting treatment from you. I told you, I said, Dr. Rapaport, one of the things that helps me, and again, not a cure, but a functioning thing. I said, Dr. Rapaport, taking hot showers every 2 to 3 hours is the only thing that's keeping me sane. And all my friends said, oh, you're out of your mind, you're taking hot showers, you're doing damage and all that. And your comment, which will live in my brain forever, was that hot shower is going to do far less damage than you gouging and attacking your skin with scratching. And I never forgot that.
Safe therapy, if it gives you relief. I have told every patient that I have taken care of the 6,500 and others on the internet, jump in the tub. What should I put in the tub? Nothing. It's the water. No Dead Sea salts, no bleach, no Aveeno. It's the water. What does it do? It doesn't do anything, but you feel damn good after 30 or 60 minutes. Doesn't last long. You jump in the bath later on in the day again. 100% of the patients love the bath. Now, scientifically, what you're doing is opening the blood vessels up with a hot shower. For some reason, that's easing your discomfort, which is fine. That's the way it goes. Cold is more logical. It closes the blood vessels down and your symptoms would have gone away. But how can we tolerate a cold shower?
Right.
So you found some aid and it abated your symptoms. Fine, it's safe. Do it. But you're in the middle of a garden party dressed in a tuxedo. It's very tough to run in and take a shower and come out dressed again. How many garden parties have you gone to recently?
Do you want to tell the story about going out to dinner together?
Going up where?
Out to dinner together? Do you remember?
Can't recall.
We were at the beach.
Okay.
And I got up and left the table.
Oh yes. We went to dinner. we got social. Our wives liked each other. You're a very smart man. You read a lot, and I was pleased to discuss books. And we went to dinner to engage in more social activity, and you get up and leave. I think it was once. It could have been twice. We were at a club where they had a shower, a beach club, and they had a shower place. And I think it might have been twice. And we just sort of, your wife and I looked at each other, we shrugged our shoulders, and you came out pleased, and you sat still and quietly ate until you needed the second shower. What a way to live. You lived like that for a long time.
And you appear to be a nut. Me, I just had to embrace it. This guy's crazy.
You did everything that gave you relief. You're a sane man. But look at what was on your mind 24/7. 24/7. And you worked. You didn't miss a day of work. I don't know how the heck you did it.
Yeah. Yep.
So you're I hate this because Itzane uses it all the time, and so some of the other support groups. They use the word warrior. Well, we're not fighting in the Crusades. We're not going against Russia and the Ukraine. You're not a warrior. You're a despondent, depressed patient. Warrior. Who are they trying to uplift?
You're a despondent, depressed patient whose entire social circle thinks you're nuts.
Yes.
Your entire social circle thinks you're nuts, and you're not seeking the proper medical care.
Yes.
Yeah.
Or you need psychiatric care.
Or you need psychiatric care. Yeah.
And stop bothering me. I heard your story enough.
Right.
You know what? I don't want to hear it anymore. In fact, we better not get together anymore. You lose all your friends.
I have a little different take on some of these organizations that have the stories of withdrawal, and I can tell you, I read them. I read the testimonials, and they all say length of withdrawal 8 months, 12 months, 13 weeks. And when I first read that, I'm like, oh, that's beautiful. I can do 14 months.
And
not even close. No. It gives, again, it's that false hope. It's right in that bucket with eating GMO only vegetables.
They were on a honeymoon for a moment in time, and they have to write it up. They have to tell the world they're cured. No, you're not. You're on a honeymoon. And they flare it again. They forgot to write that the next time.
You're going to have a bad life from 3 to 5 years. The only answer is symptom mitigation, and that's it, right? Is that
or cyclosporin if you are not functioning?
But that's symptom mitigation.
I want you to function.
Yeah, right.
You must live. You cannot give up any more days of your life. It's inappropriate. You're healthy and well. And doctor induced. I will not allow my colleagues to do this to you.
You said before we started, I don't know if the people can see on the bookshelf behind you, there's that, what is TSW? That's a hat that the gentleman that was in your movie was wearing. And this is the guy that was so miserable that all he could do is lay on the floor. Remember? In the
For a year and a half.
For a year and a half.
Scratching.
And that breaks your heart. Because it's not necessary.
No.
Not necessary.
No. No, and the producer-director, James Keach, found this individual and others, and they told their story, but they toughed it out, and I suggest very inappropriately. They did not seek medical care.
Yeah.
1 day of losing your life, 1 week is inappropriate. Try 3 years, 5 years, 7 years. Absolutely scandalous, worthy of imprisoning the doctors, or for sure suing them for malpractice.
Well, I have many, many more comments that we need to go through, but I'm concerned about the length of this video. Thank you everybody for staying with us. Maybe we can do it again next week. Is that okay?
I think it's a great idea. I think your thoughts are proper. And as we discussed off camera, another approach coupled with this might be appropriate to catch the eye and ear of a larger population.
Yeah, and I think what we're saying is we're going to start publishing, you're going to start publishing in consumer-driven magazines, prevention, magazines for pregnant women, lifestyle magazines, that sort of thing, and flip the script a little bit and get people talking more about this while going to their physicians, rather than relying upon academia and that closed circle of experts to get the word out.
Yeah, for some reason, the populace have bought into the idea that that building, that building filled with self-anointed gurus and professors have the answer for everything. We don't know what their names are, but that building will cure me. And that's where they flock. And they're totally wrong, because that building is filled with novices who have no understanding of disease often.
So please remember to like, share, and subscribe. We'll have more content shortly. Thank you for sitting through these 46 minutes. It's just great that you're all with us, and appreciate anything you can do to spread the word and post this on social media, and just keep communicating what we're doing. Thank you.
John, you're the best. I appreciate your questions and your sagacious approach towards everything.
You're infallible. Thank you for staying after this, and certainly contributing your own time and resources. It's for the people who are going through this, it's just I cannot express enough gratitude. So thank you, and we'll see you in a week.
Fine.
Okay, bye-bye.